So, which of the following is the most likely origin of the lymphoma? So, a 60-year-old man presents with dyspepsia and weight loss. He has a history of chronic gastritis due to H. pylori infection. Upper GI endoscopy shows a gastric mass. Biopsy of the mass shows an infiltration with small monoclonal B cells and lymphoepithelial lesions. Um, so I think just based off of this, we need to diagnose what kind
Okay.
of lymphoma it is. Um, Definitely not Burkitt's.
Okay.
I don't think it's also adult T cell because I know
Okay.
those are related to like T, HVTV.
Okay. I like where you're thinking. Okay. So what kind of lymphoma can get chronic gastritis with H. pylori cause? So you have to think of associations here. Do you remember?
No, the issue is that I don't. The issues here. Um, like a B cell lymphoma,
Okay. So B cell
right?
lymphoma.
Just because of like the monoclonal B cell.
Sure. I like that. Okay, so let's go with that since you don't remember the exact diagnosis. I like that. That's a step forward towards the right diagnosis. So now, let's look at the answer choice now. So you think it's some kind of B cell lymphoma. So now they're asking what's the origin of the lymphoma, you think?
Um, so just because the fact that I think it's B cells, like B cell lymphoma, I am deciding between either the spleen or the thymus.
Okay.
But if I remember correctly, I think it's spleen. No, it's thymus that makes the B cells.
You want to go with thymus?
I'm not quite sure. I have like a whole thought process, but I just don't know if it's like correct.
That's okay. Talk it out with me. Talk so I can hear what you're thinking.
So what I'm thinking that okay, so if it's a B cell lymphoma,
Okay.
where does B cells come from? That's like the point where I'm stuck at because I don't remember where they come from.
So,
And I'm
so I see your train of thought, right? You're thinking about where B
mhm,
cells come from, right? But instead of thinking about where B cells come from, right, you want to directly relate this question to this patient, right? So this
mhm.
patient has a lymphoma of the stomach. So where do you think that lymphoma originated? You get what I'm trying to say?
If it originated from the stomach, then I'm going to go with the mucosa associated lymphoid tissue.
Okay, final answer.
Final answer, yeah.
Does it make sense? And also, okay, so you
Mhm,
want to pick an answer choice that relates directly with the case or the question, right? And also on top of that, if
mhm,
you remember H. pylori, if you don't treat it over time, it can become a maltoma or a mucosa associated lymphoid tissue lymphoma.
mhm.
Do you remember that? A maltoma,
No.
right? Malt lymphoma, right?
Oh,
And so that's associated with H. pylori. And so if you can't remember that, then you have to say, okay, so she has this mass in the stomach, then, it has to be
mhm,
from B cells within the stomach, in the mucosa. Okay.
mhm.
All right. And so
I think I
germinal,
just thought too deeply of it.
exactly, exactly. You don't have to go too deep. You have to relate it back to the question. Your answer should be the most direct to the question. Okay.
Mhm.
All right. And so remember,
Understood.
thymus, thymoma, right, associated with mediastinal mass and myasthenia gravis. Spleen is not the origin, right?
No.
But it can have B cell lymphoma, right? Germinal centers, right, can also have B cell lymphoma. Peripheral blood, right? That's leukemias, not really lymphomas, right? And so, yeah, best answer here is going to be B.
Understood.